Imagine a world where a simple infection could kill you. Where surgeries and life-saving treatments are too dangerous to attempt. Where the medicines we rely on to fight infections just don't work anymore. Sounds like a dystopian movie, right? But it's happening right now. Antibiotic resistance is quietly becoming one of the greatest threats to humanity and our planet. Stay with us, because in the next few minutes, you'll learn what antibiotic resistance is, how it develops, the terrifying consequences, and what we can do to stop it before it's too late. The simple question here is, why is antibiotic resistance such a problem? Well, imagine trying to treat a common infection and realizing there's no effective antibiotic available. That's already happening with infections like tuberculosis, pneumonia, urinary tract infections, and even sepsis. Without effective antibiotics, medical procedures like chemotherapy, surgeries, and organ transplants become too risky to perform. The Lancet published that 4.71 million deaths were linked to bacterial antibiotic resistance in 2021 alone. That's more than the deaths caused by HIV or AIDS and malaria combined. And if we don't act soon, 39 million people could die from resistant infections in the next 25 years, 5 times the death toll from COVID-19. So, what is antibiotic resistance? Simply put, it happens when bacteria evolve and become resistant to the antibiotics that used to kill them. This makes infections harder, or even impossible, to treat. It's not humans or animals becoming resistant, it's the bacteria themselves that are adapting to survive the drugs we use. This is why antibiotic resistance is often called the silent pandemic. But, how does antibiotic resistance develop? It all starts with genetic mutations in bacteria. Every time bacteria divide, there's a chance of a mistake in their DNA. These mutations can sometimes make them resistant to certain antibiotics. When we use antibiotics, we kill off the weaker bacteria, leaving the resistant ones behind to multiply and spread. And, here's the kicker, when we use antibiotics improperly, like stopping a course of treatment too soon or using them for viral infections, we give bacteria more opportunities to evolve resistance. What causes antibiotic resistance and what's driving the rise of antibiotic resistance? Here are the main causes. The very first one is misuse of antibiotics. Using antibiotics for viral infections, like colds or the flu, where they don't work at all. The second one is not completing treatment. Skipping doses or stopping antibiotics early lets bacteria survive and become resistant. The third one is overuse in agriculture. Antibiotics are often used in animals not just to treat illness, but also to promote growth. This creates a breeding ground for resistant bacteria. And the fourth one is pollution. Waste from healthcare, pharmaceutical industries, and agriculture spreads resistant bacteria into the environment. So, now, how can antibiotic resistance be prevented? Can we prevent antibiotic resistance? And the answer is yes, we can. Here's how. Use antibiotics wisely. Only take antibiotics when prescribed by a doctor and complete the full course of treatment. Avoid demanding antibiotics. Don't ask for antibiotics when you have a viral infection, like a cold or flu. Control agricultural use. Antibiotics should only be used for treating sick animals, not for growth promotion. Improve hygiene and sanitation. Better hygiene practices in hospitals, clean water, and proper waste management can reduce the spread of resistant bacteria. Invest in research. Governments and pharma companies need to develop new antibiotics, vaccines, and diagnostic tools. Then what are the consequences of antibiotic resistance? Here is the list. Infections become untreatable. Antibiotics we rely on to treat common infections like pneumonia or skin infections may no longer work. Increased healthcare costs. Treating resistant infections often means longer hospital stays, more expensive medications, and more invasive procedures. Risk to medical procedures, surgeries, cancer treatments, and organ transplants become dangerous without effective antibiotics. Higher mortality rates, particularly in young children, the elderly, and those with weakened immune systems. So, which infections are becoming resistant to antibiotics? Let's see our list here. Tuberculosis, or simply called as TB. Drug-resistant TB is one of the most concerning diseases, making treatment extremely difficult. Urinary tract infections, called as UTIs in short, a common infection that's now showing resistance to antibiotics like fluoroquinolones. Pneumonia and respiratory infections. Streptococcus pneumoniae is becoming resistant to several antibiotics. Bloodstream infections, including those caused by E. coli, Klebsiella, and Enterococcus, leading to deadly sepsis. How does antibiotic resistance spread between bacteria? Well, bacteria don't keep resistance to themselves. They can share it through 3 genetic transfer mechanisms. 1. Conjugation. Bacteria can transfer resistance genes directly to each other. 2. Transformation. Bacteria absorb free DNA from their environment, picking up resistance traits. And 3. Transduction. Viruses that infect bacteria called as bacteriophages can transfer resistance genes between different bacteria. This makes the spread of resistance incredibly fast and dangerous. So, what's being done to combat this crisis? There's good news on the horizon. The first one is global efforts. The World Health Organization and governments worldwide have adopted action plans to combat antibiotic resistance. The second one is national action plans. Over 178 countries have developed strategies to tackle the problem through the One Health approach, which looks at the connection between human, animal, and environmental health. The third one is innovative solutions. Research is ramping up to find new antibiotics and alternative treatments. Harvard is leading a $150 million project to develop rapid diagnostic tools and discover new antibiotics. And the fourth one is public awareness campaigns. WHO's World Antibiotic Awareness Week and campaigns like the Go Blue campaign are raising awareness about responsible antibiotic use. Can antibiotic resistance be reversed? Unfortunately, once resistance occurs, it's extremely difficult to reverse. But we can slow it down. By using antibiotics more wisely, investing in research, and creating stronger regulations, we can keep resistant bacteria from spreading further. The key is to act now, before we lose the battle. If you've experienced antibiotic resistance, share your story in the comments. Don't forget to like, share, and subscribe for more health insights. Stay safe, stay healthy, and thank you for watching.